Hello, this is Dr. Jack Wolfson, the natural cardiologist, talking to a good friend of mine, Dr. Michael Dangovian. Dr. Dangovian is a very successful natural cardiologist practicing outside of Detroit, Michigan. And Dr. Dangovian and I are going to be discussing yoga and the cardiovascular benefits of yoga. So thank you, Dr. Dangovian, for being with me today.
Hi, Jack.
Let's dive right into it. What would you say the benefits are of yoga regarding the heart?
With respect to the heart, the benefits of yoga are besides reversing heart disease, lower blood pressure, lowering cholesterol, it reduces stress, and it improves pretty much every aspect of someone's health care. It's probably the most important thing that somebody can do for their heart.
And how would someone start a yoga regimen if they're kind of like me, they've never really done yoga or haven't done it in 15, 20 years? What would be the best way to really get into it?
I think the best way to do that would be to first talk with your cardiologist and see if they have any people that they would recommend. The other thing would be to check around some of the local studios. The important thing to realize is that especially in the older population that people do yoga with is that they might want to start with something more meditative, a little bit slower, and not worry so much about getting into the twisted postures or positions that we often associate with yoga. Yoga is actually creating an awareness of our connection to our body and our breath, and that's what gives us the benefit of that. So simply by slowing down and feeling your breath go through your body can create a meditative response, which in essence is actually doing yoga.
Gotcha. I mean, so it sounds like really from a cardiac standpoint and general health standpoint, one of the main things is that yoga is just amazing as far as stress reduction. And we clearly know stress is associated with cardiovascular and all disease, so therefore there's clear benefit here. Are there any people that you can think of that really should not be doing yoga?
When you really get down to it, again, by realizing that it's not really just about getting into twisted postures, and it's actually more about creating a balance. What I like to say is that coronary disease is a chronic dis-ease, and what we're really trying to do is seek a state of ease. When our bodies become more balanced, our breathing becomes more balanced, and we do things to create a better breath, we're actually changing everything about our body. It affects our oxidative status, our immune status, our inflammation. Everything is affected. So almost anybody that can speak and understand what you're saying is capable of doing yoga on some level.
That's fantastic, and I love how you use the term dis-ease as kind of a play on disease, and that it really is what disease is from. It's from just dis-ease of the body, where the body's just out of sync in a multitude of ways, from food, nutrition, and certainly lack of relaxation and overburden of stress. Are there any symptoms that our cardiac patients should look out for if they are doing yoga, that is the more stressful form as opposed to the meditative form?
Well, really, what's going to happen is that people are going to start to use muscles that they haven't used before. When they start to use these muscles, as a cardiac patient, oftentimes people become very concerned, and sometimes maybe even over-concerned, which is actually very warranted. I call it the vigilante syndrome. When you start to feel any pain between your diaphragm and your lower jaw, you think it might be another heart attack, because most people feel they're pretty healthy to begin with. They get a heart attack and they feel like their body's betrayed them. So what will happen is you'll go through a period of trying to decide which pains are from your heart, which pains are not from your heart. So anything like chest pain, shortness of breath, palpitations, which are like extra heartbeats, and almost anything, you just have to work that out with your cardiologist. Work with them closely, and in time you'll be able to sort that out. Also, the interesting about yoga, especially when you get into the more meditative aspects, is that emotional things come up. And this is something that's a little bit different, maybe not discussed enough, And these emotional things are something that's important to work through, because when you work through these things, you can actually reduce your risk of other events.
Fantastic stuff. So it sounds like really yoga should be part of a good, healthy regimen for anybody, and certainly for our cardiovascular patients. So Dr. Dangovian, I appreciate you so much for being on film with me today, and we'll look forward to more information from you in the future on this topic.
Thanks, Jack. Have a good day.